Good evening, viewers. Welcome to We Talk Culture, where we literally talk culture. I'm your host, Queen B, and today we're going to be talking about Filipino-Americans. Today, our segment will include several special guests. Here with me now, we have Nimrod and Alistair. The Philippines is a nation located in the Pacific Ocean with over 7,000 islands and a population over 107 million people, with a life expectancy of males at 65 and a half years old and for females 75 and a half years old. The economy is agricultural based in the Philippines, with rice being the main crop and coconuts and corn being just as important. Nimrod, can you give me a description on Filipino and Filipino-American medical interventions?
Filipinos and Filipino-Americans typically support two types of medical systems. When a Filipino individual becomes ill, they might consult both a folk healer and a Western-trained physician. Just like other ethnic groups, Filipinos still use folk remedies just because it works.
Can you go into detail on the folk remedies and implications to nursing?
So an example of folk remedy is when somebody has an asthma, they'll give them a pigeon egg, and they have to eat this in the morning for 40 days for their breakfast. And then another one is if somebody has high fever, aspirin dissolved in lemon juice, and they rub it on the patient's body, it is believed that it's going to reduce the fever. If somebody has jaundice, they scratch the patient's forehead or chest with a razor blade. And as nurses, we have to remember that folk beliefs are an important part of some Filipino Americans' lives and may significantly influence their health practices. It's important that we remember that these practices can be beneficial, neutral, or harmful. We just have to we have to recognize these things.
Are there any special beliefs that Filipinos have?
Filipinos have three concepts that underlie their beliefs and practices. So the first one is flushing, the second one is heating, and then protection. Flushing is based on a theory that the human body is a container that can collect impurities. Flushing is a complex that stimulates perspiration, vomiting, flatulence, or menstrual bleeding for sole purpose of removing evil forces from the body. Common home remedies to promote flushing is drinking vinegar. Drinking vinegar to cure the body from common cold. In some cases, Filipino will mix vinegar with water and salt or hot pepper to stimulate perspiration to remove all the evil and bad things from the body. Heating is the belief that hot and cold qualities must be in balance in the body. Protection involves safeguarding the natural boundaries of the body from supernatural as a natural force. A lot of Filipinos are deeply religious and God-fearing, and they believe that many diseases and illnesses are the will of God. And when a Filipino client is given a poor prognosis, the client's gonna keep hoping, stay positive, hope for the better, and hope like they'll find a cure. But despite knowing how bad the problem is and the disease, this type of attitude can help explain why some Filipino clients are not complaining and they suffer quietly. And so they believe that they can be protected from the supernatural causes by having amulets through prayers, seeking advice from folk healers, and these are some ways that they find relief even though they're still in pain.
How do these beliefs affect the nursing implication to Filipino-Americans?
As a nurse, it's important to find out if their non-compliance with the medical regimen is based on their belief or their lack of understanding.
Thank you for your time. Could you tell us some information about Filipino behavior and personality?
Yes, Jurpreet. Most Filipino-Americans are very gentle and mild, and they have passive temperaments, meaning they're just quiet, timid, It is believed that the reason is the desire for Filipinos that assertive nor aggressive, and they often appear guarded. The nurse may misunderstood this for passivity as inferiority complex. Very often, Filipino-Americans are erroneously labeled as passive-aggressive. Filipino-Americans, when angry, do have passive-aggressive behavior. These are evidenced by procrastination, stubbornness, intense craving for acceptance, and varying demands for attention. The nurse should be aware that some Filipino-American foods are high in purines, such as dinuguan, which is food prepared from the small intestines, liver, heart, kidney, and blood of pork. A patient who is following a purine-restricted diet should be instructed to modify diet with leaner meats than pork organs. Because most Filipino-American men have been reported to be hypertensive, the nurse should instruct the patients to modify traditional high-sodium Filipino diets. Foods that are considered high in sodium include traditional condiments such as toyo or soy sauce and patis or fish sauce. The nurse may suggest brands of soy sauce that has less sodium or use lemon or lime instead of patis or fish sauce. The nurse should also be aware that intercultural differences in expression of depression may be the result of differences in social structure or worldview. The concept of self is culture-specific and must be considered in transcultural care of depressed people. Respect for patients is something that the nurse has to be naturally given by the nurse.
Today we have a surprise guest. I have a surprise guest for you guys. We have Dr. Chantel, a body specialist. And she's going to give you some great information.
Hello everybody, my name is Chantel Davis, MD. I'm a doctor that specializes in body types. Filipinos, in the United States, Filipinos have a lower birth weight compared to all Americans. Filipinos are short and tend to have very small frames. Some have short limbs in comparison weight to white Americans. Filipinos tend to lag behind Japanese persons in both height and weight, Thai and Vietnamese as well. The women tend to be leaner and slimmer than most white American Filipinos are classified as members of the Mongoloid race because of very common racial characteristics. They're susceptible to a few common diseases as well. Just to name a few: cardiovascular disease, hypertension, diabetes mellitus, cancer, gallbladder disease, hepatitis B, and glaucoma is just to name a few. Heart disease is the #1 leading cause of death in Filipinos. The second leading cause is cancer, and the third leading cause is stroke. In addition, there have been relatively higher rates of hypertension have been reported with a prevalence rate of 79% as compared with 61% for the white Americans. Thank you for having me. Return back to the host.
Thank you, Dr. Chantel. That was very much appreciated. Sit tight while we take a quick commercial break. Hello, my name is Japre. You probably know a Filipino-American who has COPD, lung cancer, or heart failure. Well, if you don't, you do now. My tip is, if smoking doesn't get you one way, it gets you another.
If you have diabetes and you're on Medicare, you may qualify for a free meter from Liberty Medical. If you have type 2 diabetes like I have, you're confronted with choices. You can choose to feel sorry for yourself. I hope you don't. I hope you choose to get involved with a good doctor, find out some things about diabetes and your own body in the bargain. You'll learn to check your own blood sugar and check it often. That, along with a simple diet and exercise program, can help keep your diabetes under control. If you're on Medicare, call Liberty Medical. We'll help you keep your diabetes under control. First, we'll give you a free meter. No one is more serious than Liberty about helping you keep your diabetes under control. That's why we're a proud sponsor of the American Diabetes Association in their mission to prevent and cure diabetes.
Call for your free meter and ADA offer. Call 1-800-816-8052.
Welcome back, We Talk Watchers. Before we wrap today's show up, we have my dear friend on a live Zoom call.
Hello, thank you for having us. My name is Lisette Garcia.
And my name is Christina Lopez.
Okay, and we're going to be talking about the topic of culture in the Filipino community. One of the difficulties that they faced when coming into the United States was with language and dialect, because during the time in the 1960s in the Philippines, there was 93 Filipino languages until they adopted a policy to develop Tagalog, English, and Spanish as the official languages of the Philippines. Even today, Filipino-Americans continue to have the largest percentage of linguistically isolated people among all of the Asian groups.
So I will be talking about the style of the Filipino culture of how they communicate. So their style is, quote from Shiramoto 1977, noted that the elderly Filipino man is concrete in thinking and pragmatic in problem solving. Also noted that when a Filipino man acknowledges emotions in a verbal manner, this might be interpreted as a sign of unmanliness or weakness. Decisions may be referred to a family members using the people living outside the country or inside the United States of America to make decisions for the family.
Nonverbal communication is important for Filipino persons. Little eye contact is likely to be used with superiors and authority figures. Silence is also a tool used to determine approval or not. Filipinos tend to be very polite and behave agreeably, even to the extent of personal inconvenience. This term is called pakikisama, which means getting along with others at all costs. Handshakes are not commonly practiced. The elderly are usually shown respect by being kissed on the hand, the forehead, or the cheeks.
As far as tone goes, Filipino Americans tend to use the voice to emote or to romanticize the language. Typically, however, Filipinos are soft-spoken and will say nothing rather than disagree.
Rituals related to death and dying. The family is very protective and would rather hide the diagnosis from the patient. All matters are discussed with the head of the household. Usually if the family is Catholic, which most Filipinos are Roman Catholic, they usually get a priest to give the sacrament of the sick, and the patient is anointed with oil. They prefer to die at home with dignity, with the family at the bedside praying for them.
As far as nursing implications go, it is important for the nurse to remember that the Filipino-American clients may be hesitant to express feelings and emotions in a group setting. It is often difficult for the nurse to begin interventions immediately without a period of small talk on topics considered safe conversations, such as the weather, the conditions of family members, or sports events. A large majority of Filipinos have difficulty understanding medical jargon. It is important for the nurse to remember to use an interpreter. The nurse should be aware that many Filipinos use a smile or raised eyebrow as an acknowledgement of what has been said rather than giving a verbal response. So this is Christina speaking.
And Lisette Garcia.
Thank you for having us on. Ciao.
Thank you for watching with us this evening. I hope you guys learned a lot about the Filipino culture and its implications to nursing. with the life and Dr. Chantel, a body specialist, and she's gonna give you some great information.
Is this recording?
Home remedies simply because it hurts.
Yeah, we call it albulario. So we have